Once we have made sure all of our equipment is working properly and the patient is undressed and put on a gown, we're going to take our scout image. Our scout image is taken before the exam to make sure there is no artifacts, and we're looking for body structure and their anatomy, and we're looking for any abnormalities within the GI tract. We're also looking to see how well their cleansing process went with the cleansing kit. Once we have taken our scout image and the procedure is over with, the doctor will order a series of overhead images. Our first image is going to be a right lateral decubitus position. The patient will be laying on their right side, and this will show air levels on the lateral side of the descending colon and air levels on the medial side of the ascending colon. Keeping the patient on their right side, we will move our tube above the patient. This will be our lateral rectum shot. This will demonstrate the distal sigmoid area as well as the whole rectum. From the lateral position, we will have the patient flip onto their stomach. This will allow us to go into our first oblique image. They will put their right shoulder down with their left side up. This will be our RAO position. This will allow us to visualize the right colic flexure as well as the ascending colon. Having the patient roll onto their stomach now, we will shoot our PA projection. This will allow us to see the large colon in its entirety. We have the ascending colon, the descending colon, the transverse colon, and the rectum and sigmoid area. We want to be sure to include both the right and the left colic flexures all the way down to the rectum. Next, we will keep our patient in the same position. This is now our PA axial. We are going to angle our tube 30 to 40 degrees caudad, centering at the as is. This will allow us to extend the sigmoid area and allow no overlapping of the sigmoid. From our PA axial, we will go into our left oblique. This will put our patient in an LAO position with their left shoulder down and their right shoulder up. This will allow us to see the left colic flexure in its entirety and the descending colon. From our left oblique, we will go into our left lateral decubitus position, shot PA. This will once again demonstrate air levels within the colon. We will now see air within the medial side of the descending colon and air rise to the lateral side of the ascending colon. Our last image is the post-evac. This will be taken after the patient has defecated and got what they could out of their large colon. This will allow us to visualize how much barium is left within the colon, and we will instruct the patient to drink as much water as possible and to stay hydrated to flush out the rest of the barium.